Before we understand about anxiety and depression together, let's understand anxiety and depression a little separately. But before that, let's understand the common link between anxiety and depression. So, what are these mental health illnesses or disorders? Basically, all of this is connected to the mental health. And what is mental health? That is the health of the mind. So, how there is a body, and for the body, there is a physical health. The same way, there is a mind, and for the mind, there is a mental health. So just like for the body, we exercise, we eat healthy, we go for the spa, we do all the nice things for our body so that we stay healthy. The same way, there are certain things that are supposed to be done for the mind so that it stays healthy as well. And when there is a disturbance in that regards, it leads to mental illnesses. Mental illnesses, for example, like anxiety, depression, and there are many other things like bipolar disorder, schizophrenia, and others like that. And what are these disorders? How are they happening? Basically, we have certain chemicals in the brain. So, just like how our body requires hemoglobin, vitamins, the same way our mind requires chemicals. These neurochemicals, for example, serotonin, dopamine, norepinephrine, and so on, are responsible for keeping us positive and stable. But whenever there is a disturbance in the level of these chemicals, it leads to these disorders. And among them, the most common ones are anxiety and depression. Now, anxiety and depression occur when there is a disturbance in a particular neurochemical called as serotonin. This serotonin is like petrol to the car. So, for example, when the petrol for the car is over, will the car work? No. Even if you get servicing done for the car, you clean the car, you push the car, will the car run? No. It requires the petrol in it. So, the same way the mind requires this serotonin in an adequate amount. If it's not there, then the way we look at things appear to be very negative. For example, that's a very common WhatsApp message that a lot of people have seen. The same six appears a nine to someone else. So that perspective is what changes when your level of serotonin reduces. So anxiety and depression both stem through the same chemical deficiency of serotonin. But depending on which part of the brain is disturbed is when it leads to either anxiety or depression. Anxiety is more so about fear. It's more so about restlessness. It's uneasiness. Or in Hindi, we sometimes even say ghabrahat. While depression is more so related to the mood. Depression is a mood disorder, which leads to sadness, udasi. And both of these conditions have few common things as well, but mostly both are completely different, and even the treatment, which includes therapy and medications, are different for both of them.